Proximal, tibial, fibula, synostosis.
All right, patient is going to be supine, arms at their side, completely relaxed. Knee is going to be flexed to 90 degrees. Clinician's position. I'm going to sit on the dorsum of the foot. Sorry, I keep getting in your way. One hand, I'm going to be stabilizing the tibia. The other hand, I'm going to grasp the head of the fibula. How to perform the test, I am going to translate, oh, yours moves a little bit. I'm going to translate the fibula in an anterior, yeah, yours really does move, anterior and posterior direction. This is for a hypo or hypermobile tib-fib joint. If it's an acute injury, if the fibula translates too much anteriorly, it is the posterior superior tibiofibular ligament that's involved. If it translates too far posteriorly, it's the anterior superior tibiofibular ligament. Although both of those ligaments are involved along with the interosseous membrane. That's that one. What's next?
Slocum, ALRI.
All right, patient's position, we'll have you sideline facing that way. The unaffected leg, which will be her left one, her hip and knee is going to be at a 90-90 position to stabilize her. I want her body in like postural alignment, so let's get your back a little bit closer to the end of the table, like your shoulders, there you go. All right, she is going to have slight external rotation at the hip. The medial aspect of her foot is going to be flat on the table. My position, one hand is going to be on the distal femur. My other hand, the thenar eminence, is going to be on the head of the fibula. How to perform the test? First thing that I'm going to do is at least initiate some internal rotation of the tibia. Simultaneously to that, I'm going to provide a valgus force, and I'm going to provide a force that moves her into flexion. So I'm pushing at a 45-degree angle. It's going to look like this. And slide you a little bit more. I'm going to try it again. Okay. Valgus, and I'm going to move you just like that. All right, so this is for anterior lateral rotatory instability. What dictates a positive test is I will have subluxed the joint in its starting position with the knee extended. When I hit 40 to 60 degrees of knee flexion, it will spontaneously reduce itself. Next.
Sorry,
One job.
I was sitting there getting a better look. It's the flexion rotation drawer.
All right. Patient is supine. Flexion rotation drawer also goes by flexion reduction drawer. She's going to be arms at her side, completely relaxed. Actually, I need you a little bit closer. Right there, that's perfect. All right. This is partly her position, partly how I'm doing it. We are going to flex her hip to 25 degrees passively, also passively flex her knee to 25 degrees. That should result in the tibia being parallel to the table. I'm going to have one hand over the tibial tuberosity, that's right here. My other hand is going to be grasping the medial malleolus. So how to perform the test? I'm going to provide 3 simultaneous forces. The first one is going to be posterior displacement of the tibia. Second one is going to be axial loading force along the long axis of her body. Then I'm going to provide a valgus force. Once those 3 forces are applied, I'm going to move her into knee flexion. So here's posterior, here's axial loading, here's valgus, and now I'm going to move her into flexion. So what is this testing for? Anterior, lateral, rotatory instability. What dictates a positive test? When I provide those 3 forces, I have subluxed the tibia on the femur. As I approach 40 to 60 degrees of knee flexion, the femur or tibia will spontaneously reduce itself with a clump. What's next?
Micah,
Which one?
the medial. That's for me.
Medial synovial plexus.
We're going to do the seated, although you can do it lying supine. All right, patient begins with the knee in 90 degrees of flexion. With one hand, I'm going to have my thumb over the lateral border of the patella, attempting to slide or glide the patella medially. Remember, it won't move much because of this position. With this hand over here, I'm going to passively internally rotate the tibia. How to perform the test, I am going to go ahead and move the knee from this position into extension, all the way up. As I do that, the patella will move over a little bit. What am I testing for? This is for a plica. What dictates a positive test is as she approaches the range of 40 to 60, I might feel a little bit of a catch or a pop in that just along the medial border of the patella, and that is a positive finding for a plica.
Stutter test.
Stutter test is kind of the same thing, but it's an active test. Patient is going to be supine, knee flexed at 90 degrees. I'm going to be along the side. I'm going to grasp the anterior medial side of the knee along the medial border of the patella. Now I'm going to ask her to actively extend her knee all the way to the end. Positive finding here is a stutter or a catch along the medial border of the patella as the plica gets caught in the medial femoral compartments.
You said she was supine, or did this one supine or seated?
I would, this one is definitely going to be seated.
Oh, okay.
The other one you could do supine or seated, but it's very difficult to passively extend a knee in a supine position. In the book it's supine, but it says you can do it seated. I think it's easier seated.
Reverse pivot shift.
Reverse pivot shift. All right, you're supine, arms at your side, completely relaxed. All right, my position, I'm alongside. I'll talk about my hand position in a second. I'm going to start her in the 90-90 position between her hip and her knee. I am going to have one hand that is going to be over the medial malleolus. My other hand is going to be at the head of the fibula. How to perform the test, I am going to externally rotate her tibia. I'm going to provide a valgus force, and then I'm going to move her into extension. So, what dictates a positive test? This is for posterior lateral rotatory instability. And what happens when I first apply the external rotation and the valgus force, I sublux the femur on the tibia. What dictates a positive test is as I am moving her through a range of 40 to 60 degrees of knee flexion, the tibia will spontaneously reduce itself on the femur. I think that's everything. Is that it?
Yep.
That's all of them?